Imagine discovering that the number your doctor has always considered normal for your age may be shortening your life. And that the ideal blood pressure for seniors may be much lower than you think. And that can save your heart, protect your mind, and give you more years of independence and vitality. Hello, I'm Dr. Natisha James, a physician specializing in senior health. And today I'm going to share with you the up-to-date medical truth that is changing the lives of thousands of American seniors. If you are 60 or older or care for someone you love, this video may be one of the most important you will watch this year. Stay with me until the end because I'll reveal real numbers, recent American studies, and a practical plan you can start later this week. In the meantime, if this theme makes sense to you or your family, leave your like now, so YouTube understands that this content is valuable and delivers it to more people who need it. And subscribe to the channel by activating the Tinkerbell. Every week I bring you reliable and up-to-date information that helps you live longer with health and quality of life. Feel free to write your city or state here in the comments below. It is always a great pleasure to hear from people from all over the country and the whole world. Let's get started. Dr. Natisha James here again. Now that you already understand how urgent this topic is, let's get right to the heart of the problem. In the United States, high blood pressure is extremely common among people 60 years of age and older. More than 70% of American seniors live with high blood pressure. This means that if you are watching this video, the chances are high that it will affect you, your spouse, your parents, or someone very dear to your family. The most dangerous thing is that high blood pressure acts quietly, like a thief who steals your health without making a sound. Year after year, it damages the arteries, hardens the walls of blood vessels, overloads the heart, and affects vital organs such as the brain and kidneys. Over time, this dramatically increases the risk of heart attack, stroke, heart failure, kidney problems, and even cognitive decline. American studies show that uncontrolled hypertension is one of the main responsible for cases of vascular dementia in the country. The brain needs constant and healthy blood flow. When the pressure is elevated for a long time, small vessels are injured, inflammations occur, and the risk of loss of memory and independence grows significantly. Many seniors still hear the dangerous phrase, "Your blood pressure is a little high, but it's normal for your age." This old idea may be costing you precious years of your life. The up-to-date medical truth is that high blood pressure has never been normal, and today we know that controlling these numbers brings real, measurable benefits, even after the age of 60, 70, or 80. Think about what's at stake. Every point you can safely reduce could mean less risk of hospitalization, more energy to enjoy your grandchildren, more years living independently in your own home, and less worry for your family. The good news is that it's not too late. Your body responds positively when you take action. In the next few minutes, I will show you the surprising truth about what the ideal pressure in the United States today really is and how to achieve it intelligently. But before revealing the numbers that can change everything, understand this point well. Ignoring blood pressure is not a safe option. Controlling it can be one of the most important decisions you make for your longevity and quality of life. Now that you understand the seriousness of the problem, let's go to the revelation that surprises most American seniors. For decades, many doctors in the United States accepted that a blood pressure of 140/90 was tolerable for people over 60. That view has changed. The latest guidelines from the American Heart Association and the American College of Cardiology, published in 2025, set a clear new standard for most adults, including seniors. The ideal blood pressure you should aim for is less than 130/80 millimeters of mercury. And, when safe and tolerated, the evidence encourages getting as close as possible to less than 120/80. Yeah, that's right. The figure that once seemed too low for age is now considered the most protective. This change is surprising because it goes against what many seniors have heard for years. But American studies are blunt. The famous SPRINT study, conducted here in the United States, demonstrated that seniors who achieved lower levels had significant reductions in heart attacks, strokes, heart failure, and even overall mortality. In addition, tighter control helps protect the brain, reducing the risk of cognitive decline and dementia. The current categories used in the United States are as follows: normal, less than 120/80 elevated, 120 to 129 by less than 80 stage 1 hypertension, 130 to 139 by 80 to 89 stage 2 hypertension, 140 or more by 90 or more for the vast majority of seniors who live independently and are not frail. The recommended goal is below 130 by 80. However, each case is unique. For people aged 85 or older, very frail, in nursing homes or with multiple comorbidities, the doctor can adjust the goal to a slightly more conservative level, always based on shared decisions. The most important thing is this: lowering the pressure intelligently and safely brings real benefits. More years with quality, more independence, and less fear of serious events. In the next segment, we'll talk about the risks of not controlling and also the dangers of downloading too much. But know it right away. For most American seniors, the surprising ideal is lower than you thought. And it's within reach. Now that you know what the ideal blood pressure is in the United States, it is essential to understand both sides of the risk. The danger of leaving the pressure high and the danger of lowering it too much. Leaving high blood pressure for too long is like leaving a hose under high pressure slowly leaking. Over the years, it causes silent but serious damage. In the United States, uncontrolled hypertension is responsible for hundreds of thousands of strokes and heart attacks every year among seniors. It overloads the heart, which can lead to heart failure. It damages the kidneys, increasing the risk of dialysis. And in the brain, it destroys small blood vessels, significantly raising the risk of vascular dementia and Alzheimer's. American studies show that seniors with pressure consistently above 140 by 90 have a much higher risk of losing independence, needing constant care and facing frequent hospitalizations. Each year that pressure gets out of control robs quality of life and can shorten life expectancy by several years. On the other hand, lowering blood pressure too much also brings serious problems, especially for seniors. When the pressure drops excessively, especially when getting up from bed or chair, orthostatic hypotension arises. This causes dizziness, dark vision, weakness, and greatly increases the risk of falls. A fall in seniors can result in hip fracture, prolonged hospitalization, and in many cases, permanent loss of mobility. People aged 80 and over, who take various medications or who already have balance problems, are the most vulnerable. Too low pressure can also reduce blood flow to the brain, worsening memory and mental clarity, the exact opposite of what we want. So balance is key. The goal is not to reach extremely low numbers at any cost. The goal is to find the right track for you, safe, protective, and sustainable. This requires individualized medical follow-up, careful medication adjustments, and regular monitoring at home. The most important message of this moment is: acting is essential, but acting wisely and safely is what really protects. Not treating is risky. Overreacting too. Dr. Natisha James continuing. Now that you understand the risks on both sides, the next step is to learn how to measure your blood pressure the right way. Measuring at home is one of the most powerful tools American seniors have for tracking cardiovascular health. The measurement taken in the doctor's office may not tell the full story. The pressure varies throughout the day and can rise due to anxiety, the famous white coat effect. For this reason, major medical societies in the United States strongly recommend home monitoring. Here is the correct method, step by step. Sit in a chair with a backrest, feet flat on the floor in a calm environment. Rest for 5 minutes before measuring. Place your bare arm resting on a table at heart level. Use a cuff of the appropriate size. Too small or large cuffs distort the result. Always measure on both arms the first time to identify which has the higher reading and use that arm consistently. Avoid coffee, tea, exercise, or cigarette 30 minutes before. Do not talk during measurement. Ideally, measure twice in the morning before medications and twice in the evening before bedtime. Record the date, time, the two numbers, systolic and diastolic, and write down how you feel. Choose a validated appliance. In the United States, look for models with a validation seal from the American Heart Association or the Association for the Advancement of Medical Instrumentation. Wrist braces are generally less reliable than arm braces. Take measurements for at least 7 days in a row at first and then at least 3 times a week. Take these records to your doctor. They are gold to fine-tune treatment. Measuring correctly at home empowers you. Instead of relying only on sporadic office visits, you get real data from your day-to-day. This helps to identify whether it is actually reaching the target of less than 130 by 80 or whether it needs adjustments. Dr. Natisha James here. We come to the most practical and transformative part of this video. Now that you know how to measure correctly, let's talk about the proven strategies that will help you achieve and maintain optimal blood pressure in the United States. It all starts with lifestyle. The DASH diet, developed especially for hypertension, is one of the most studied and effective in the country. Focus on fruits, vegetables, whole grains, lean protein, and low-fat dairy. Drastically reduce sodium. The ideal is to stay below 2,300 milligrams per day, and the less the better. Many seniors manage to reduce 5 to 10 points just by controlling salt. Practice regular physical activity. Daily 30-minute walks, light strength exercises 2 or 3 times a week, and stretching already bring impressive results. Losing only 5 to 10 kilograms, if you are overweight, can lower the pressure significantly. Also control other factors. Sleep 7 to 8 hours a night, manage stress with simple techniques such as deep breathing or meditation, limit alcohol to a maximum of 1 dose per day. And if you smoke, seek help to stop. This is one of the greatest gifts you can give your heart. When lifestyle is not enough, medications come into play. Today there are excellent safe options for seniors. American doctors often start with ACE inhibitors, angiotensin receptor blockers, diuretics, or calcium blockers. The secret is to find the right combination with as few side effects as possible. Practical tips for everyday life. Use a medicine organizer, set alarms on the mobile phone, involve the family in the process, and celebrate small victories. Many seniors report more energy, better sleep, and greater willingness for grandchildren after stabilizing pressure. Remember, consistency wins perfection. Small daily changes accumulated over the weeks bring amazing results. Thousands of Americans over the age of 60 are living with more vitality precisely because they follow this path. Dr. Natisha James here to end this video with clarity and hope. Summing up everything we have seen. High blood pressure is a silent problem that affects more than 70% of seniors in the United States and seriously increases the risks of heart attack, stroke, dementia, and loss of independence. The surprising truth is that the ideal pressure for most independent seniors is less than 130 by 80, and when possible, close to less than 120 by 80. This target brings real benefits proven by American studies. We have also seen that not controlling is dangerous, but lowering too much without guidance also brings risks, especially falls. We learn how to measure correctly at home, and most importantly, we know practical strategies. DASH diet, sodium reduction, physical activity, quality sleep, weight control, and medications when needed, that really work. The final message I want to leave is this. It's not too late. Regardless of your age, 60, 70, 80 or older, your body still responds positively when you make the right decision. Thousands of American seniors are living with more energy, more mental clarity, and more independence precisely because they have put this knowledge into practice. Start this week. Measure your blood pressure correctly at home for 7 days. Write down the results. Make an appointment with your doctor and take these numbers with you. Openly discuss what your personalized target should be. Make one change at a time. Reduce salt, walk every day, or improve your sleep. Small consistent actions lead to big results. If this video was useful to you, share it with your children, grandchildren, or friends who also need this information. The knowledge that saved your health can save the health of someone you love. Again, leave your like if this content has added value and subscribe to the channel with Tinkerbell activated. Every week I bring you up-to-date and reliable medical information to help you live longer with quality of life. Feel free to write your city or state in the comments. I love reading every message. Thanks for watching so far. Take good care of your heart, take good care of your health. The best of your life may still be ahead. I'm Dr. Natisha James and I hope to see you in the next video. Big hug and see you soon.